Good morning. November is Home Care and Hospice Month. Joining us live to talk about some of the home care services offered by St. Peter's Health Partners are Michelle Miner and Patrick Archambeault of Eddy Visiting Nurse and Rehab Association. Good morning.
Good morning.
Good morning.
So first off, can you tell me why it is important to recognize home care?
So I think it's important for people to understand the benefits of home care, right? And so we have a group of talented staff just waiting to accept referrals from patients who are discharged from the hospital to make sure that's an easy transition home, to provide high-level care to patients in the community. And then also for hospice, people should understand that we have nurses who are specially trained in working with patients who are having who are facing end-of-life issues, working with those patients to bring them home in a safe environment, providing comfort care, providing spiritual and clinical care, and keeping those patients home around family that love them and support them.
And what is the Eddy Visiting Nurse and Rehab Association?
So we are a large home care agency. As a matter of fact, we're the largest in upstate New York. We provide skilled and non-skilled services to a 6-county area. We are registered nurses, physical therapists, occupational therapists, speech therapists. We are home health aides, and really making sure that the patient has those wraparound services in the community to keep them safe at home and reduce the risk of rehospitalization or an emergency room visit. So we also have a lot of specialty services, cardiac services. We have a certified diabetic educator. We're seeing more complex patients coming out of the hospital, and our staff is prepared and educated to meet the needs of those patients.
And who are our home care patients? Michelle, you work with a lot of the clients. Can you tell us a little bit more about what you do?
Well, people will say to me, "Oh, you probably work with just the elderly," and that's not true. We work with every age group. Just this morning, I was working with a new patient that had come out of the hospital with heart failure. She had coded a couple of times in the hospital. And the reason why I was late for this interview is because I was calling the physician because she didn't have her medications. So our first level of defense really is to keep people out of the hospital, is trying to make sure they have what they need. Do they have their medications? Do they have a physical therapist referral? Do they have a dietitian referral if they need it for teaching? A diet, which is very critical to people with heart failure, diabetes. So we do all that, so I was doing all that today, and turns out that no, she didn't have the right meds. So we had to call, and we had to get the right meds sent into the pharmacy before she landed back in the hospital with heart failure. So it's those little things that people really don't think about. When they go home, say, "Oh, I'm home, everything's fine." But we're looking at the big picture. We're looking at everything. What do they need to keep them home and safe?
And medication reconciliation is a major issue, and we
It
know
is.
on average, most people discharged from the hospital have at least four medication reconciliation issues, and if those aren't addressed by the home care nurse, that patient is at risk for taking the wrong combination of medications, which ends them back up in the emergency room.
And so having that connection between what's going on in the resident's home and the doctor, the physician, and as well as the pharmacy benefits the patient
Absolutely.
clearly. And not only that, but studies have shown that people do better recuperating in their home. Why is that?
Is it familiar? They're happier there. We have to go in and we have to say, what are your needs? What are you concerned about? What's bothering you? What do you want me to help you with? And you'd be surprised at the answers you get, and then you can kind of zero in on how to make this whole home care situation work for the patient. Yeah.
Absolutely. And the other thing is, we want to reduce their length of stay in the hospital, because we know that patients who are sick or in the hospital, the longer they stay, the greater they're at risk for getting these hospital-acquired infections, which are very difficult to treat and sometimes require heavy dose IV antibiotics. So we want to transition those patients from acute care to home care as soon as possible and keep them safe from all of those different organisms.
Right. And how many patients does a home nurse see in a typical day?
That depends. It depends on what. I'm going to see all my own patients because I'm one of the old nurses. I'm the old guard. I'm going to see them all. So I might be doing overtime that day, like yesterday. But typically, it's about 5. You might be seeing 6. It depends on the acuity of the visit, and if it's an admission visit. So and then the travel. You have some travel. But home care is not what it used to be. Home care is amazing. Now we can talk. I was talking to 2 physician offices this morning. You get real-time answers. They're on board. They know what we're doing out there. They know that they have to support us and we need to support them. So it's a whole it's a very it's a continuum that between, and it wasn't like that when we were young nurses, but now we can get the doctors right away. Yesterday I had a new admission. A woman came home with heart failure. And no, I'm sorry, today was the woman. Yesterday was a man with heart failure. And he had gained 3 pounds already from the day he came home to the day I went out there, and we got in right away. And the daughter was saying, I don't know what to do with him. He's having trouble breathing at night. So I called the cardiologist. The nurse got on the phone. She said, bring him in this afternoon. And instead of him ending up in the ER, which he would have, he got treated.
Our clinicians really work at top of licensure, and so we're a colleague of the physician. So when we call and we're reporting issues and symptoms that the patient is having, they know that they need to get on the phone and help us correct that issue, because if they don't, then that patient's going to be sent back to the hospital. So really, years ago, like Michelle was saying, home care was never at the table, so we were always an afterthought. And now we are at the table. We work very closely with acute care, work very closely with the primary care physician network and the specialist group, and they see us as a huge part of the continuum in order to keep these patients safe and out of the hospital.
So not only are you communicating with the primary physician, but you're talking to, like you said, the cardiologists or the orthopedic surgeons. So it really is important to have that whole, like you said, continuum.
It's wonderful. And the nurses actually now, they call me from the doctor's offices. They have nurse care managers at almost all of the medical practices, and they call me and say, what's going on with, so and so, and I can update them. Did it today.
And Michelle, you've been a home nurse, as you said, for many years. What do you love most about your job?
From my perspective, it's the flexibility. I keep in touch with my patients. We run the schedule the way they like it. I can, kind of like tweak when I'm going to be at certain people's homes. And for the patients, it's just they love it. They love it. They love having us there to keep them healthy. Healthy. And we, Patrick also, we have diabetic educators. We have a dietitian on board. We have telehome care. So those patients that have cardiac issues telehome care that's a tech thing. It's a techie thing.
Well, yeah, it is a little techie. And so we're trying to leverage our technology to monitor patients appropriately in the home and pick up on those subtle changes so we can report that directly to the physician, and we can change their medication or change their care plan before they end up in a crisis situation. So our relationship with the cardiologist, with the specialist, with the orthopedic surgeons, it's a tight collaboration, and they know they need us and we need them to manage this patient appropriately.
And I think you've touched on this a little bit, but how does home care fit into the overall continuum of care that's offered by St. Peter's Health Partners?
Yeah, so home care, again, like I said earlier, is a big contender. We are part of the discharge planning process. And so what we offer is a smooth transition for our patients from acute care to home care. And so a couple things that we make sure that we have in place. We want to make sure that we understand what the patient's biggest fear is being discharged from the hospital. We want to know what their personal health goals are. We want to know, we want to incorporate them and their family into the discharge plan, right? So we want to take their preferences into consideration. And so all of that information then is presented on visit number 1 by the clinician for the patient in the home. And they say, listen, we understand your biggest fear coming home was this. We understand your personal health goal is this. Let's work together to put a plan in place that not only meets your clinical goals, but also your personal health goals. And so that really it forms a trusting bond with the clinician, and our patients do much better with the relationship where they know that it's patient-centric, they know it's about them, than when we're trying to be in charge.
And if someone is interested to learn more about home health care and Eddy VNRA for themselves or for a loved one, where can they get additional information?
So I'd like people to know that if you want to work top of licensure, if you want to work with an organization that elevates you, if you want to work at your fullest potential, if you like working in an autonomous situation, independent, and you want to work with patients in their home, you can visit our website at www.sphp.com. Click on careers, scroll down to Eddy Home Care, click on that link, and it will give you all the job openings, or feel free to call 518-274-6200, and we will put you in touch with a recruiter. So,
Thank you. And
Thank you.
Michelle, as far as anybody who might be looking for help for their loved ones, any advice that you might be able to give them?
Help for their loved ones. I would suggest that they call their primary care physician. And a lot of people say, well, how do I get a visiting nurse? Call your primary care physician if you have one and discuss what your needs are and give us a call.
Great. Thank you both for joining us
Thank
this
you very
morning. We
much.
appreciate it.
Thank
Okay.
you.